everybody, and welcome back to another episode of Mind Matters, Navigating Head Injuries and Concussions. I'm your host, Kylie Como. I'm the legal nurse consultant here at Shane Smith Law, and today I'm speaking with Dr. Devin Gaston, a board-certified functional neurologist, CEO, and founder of Passport to Health. Dr. Gaston, thanks for joining us today.
Thank you so much for inviting me, giving me the opportunity to speak to your guest today.
Absolutely, we're excited. To our audience, if you've tuned in to any of the Mind Matters episodes before, or even if you're new here, you should know that we love to focus on all things traumatic brain injury. So with that, let's dive in with Dr. Gaston. Dr. Gaston, could you let's start off with experience. Can you share how your own experiences, maybe with, it's my understanding of some misdiagnosed strokes, transformed your own approach from this kind of primarily sports medicine focus to a more integrative neurology, mild TBI specialization, and how that really informs your own approach to caring for your patients?
Well, as they say, a lot of people with personal experience, it tends to drive the direction where they go. Well, I'm certainly no different. So I was a sports chiropractor by trade, did it for a long time, worked with the triathlon industry, really had a lot of fun with it. But like many athletes, I had my own injuries. And so ultimately, I had a kind of a freak injury about 4 or 5 years ago that really, I have to say, guided my practice from what it was with sports injury management to full-on head trauma diagnosis, especially through the diagnostics that we utilize, and rehabilitation. Yes, I did have a stroke 3 years ago. I had a stroke 12 years ago. I have a connective tissue disorder that predisposes me to strokes, and coincidentally, the stroke that happened 12 years ago when I was in my last quarter of chiropractic school was actually what really brought me into functional neurology, because it was not recognized. I had a full-blown internal carotid dissection, not from any manipulation, nothing like that. It was really a freak accident. I passed out in my bathroom, weird situation. And so anyway, that was misdiagnosed, because typically when you go to the ER, there, especially, at the time I was, 34 years old, perfect condition as far as health. They're not going to be, thinking stroke. They're not going to be running MRAs. They're not going to be doing these other images, even though they should, but they didn't. And so I ended up getting diagnosed with, vestibular neuronitis, because I had such severe unrelenting vertigo and severe disequilibrium. And then due to the length of time, it was then like, oh, it must be a labyrinthitis, which, again, going along the inner ear type of pathway. And neither one of those were correct. And in fact, it wasn't until I did my own imaging, did an MRA that I ordered in 2022 that actually confirmed what happened to me then, and then what subsequently happened to me a couple years ago. So quite literally during disability, I transformed my practice from a very already interdisciplinary. I am lab provider with Vibrant Labs. So, I was very used to running serum panels for brain and gut autoimmunity. There's a lot of markers and things that you can test for head trauma. And frankly, I spent the time building my own case. So, and in that, switched out medical devices in my practice that would help me return back to, what I love doing. But then also I'm like, well, if I'm learning this for myself, I might as well be applying this to other people. So in the last, even just 3 years, I've been certified in 5 different neuro rehab techniques, diagnostics. I'm now adding QEEG and neurofeedback to the practice. So it really has been quite literally a labor of love for other people, but also myself.
Wow, that's quite a story. Experience, unfortunately, for a lot of us, is often the best teacher. Not quite the experience that most of us would want to have, but it sure sounds like you wanted to get better, but you really capitalized on the opportunity. And we've had a couple of survivors of various, traumatic brain injuries on the program, and those are always some of our most watched and favorited programs, because that experience is so valuable and people really resonate with that. So First of all, thank you for being honest and vulnerable with our audience and really kind of digging into your own, past there. What you said about going to the emergency room with stroke, with that stroke-like syndrome, if you don't present with those kind of typical motor, neuro or motor sensory deficits, you get that CT scan and you're good to go a lot of times, and that's it. But you certainly had some of those kind of more abnormal type of symptoms that didn't get caught. This medical teams, so often consider TBI ruled out, right, with a negative MRI. So why might this approach miss those injuries, and what key findings, should change our interpretations?
The practice of looking at an MRI for mild traumatic brain injury, it's just like, this is like 20 years old as far as that goes. Like, you're not going to see, even in loss of consciousness is prolonged longer than 30 minutes, right? If we're looking at Glasgow coma scales, you're looking at severity ratings, it just doesn't even play a role, because most of the time you're really looking at connectivity issues. You're looking at the tracks, right, between the different locations and how the brain's communicating with itself. Very rarely, unless there's an incidence of, even with stroke, right? There's an instance of stroke, or someone happens to have a benign tumor that's being washed or something. It's just, you're not going to see anything structural. You're just not. Now, if you had access to other forms of imaging, such as brain DTI with SPECT processing, you can see fiber tract damage, but even that's restricted. You'll see frontal tract damage, parietal, cerebellar arteries aren't visualized very well. And it's truly the cerebellum that gets impacted, I'd say the most often as far as from a vestibular standpoint. Now, granted, to be fair, that's always going to be the lens I'm going to look through. I'm going to think cerebellar health and vestibular health first. But also, where you're really going to find things is going to be through the eyes. And so that's why I incorporate VOMS testing, VOMS. So that's vestibular ocular motor screening. So it's not just one test, it's a battery of tests that it's like you're checking out on a fuse box, is this working? Is this working? This is what a functional neurologist does. You're going to go through. Can your eyes track appropriately? Can your pupils constrict? Can you do basic things like this? You have basic coordination. If you have discoordination with your eyes, guess what? You're likely going to have discoordination elsewhere, because midline brain cerebellum, called the vermal region, there's no test on this, midline, literally how we developed in the womb from embryologically is eyes and spine. It's literally the same. So as far as the neurological control, the brain developed kind of around this basic framework, if you will. So the window really is through the eyes. If you're going to see that the eyes are going to be off, and then you can have what's called a sensory mismatch, where the brain, which is already inflamed and injured, it's what quality of information do I trust? Do I trust the information coming from the eyes? Do I trust the information coming from the inner ear? If they don't match up, the brain's like, whoa, I don't want to try to make sense of this. Bam, I'm going to leave you with symptoms. So, it's a really simplistic way kind of explaining it, but it really is that simple. The brain likes to be in balance, and you see this in QEEG, right? We want the waves to be certain amounts, we want there to be synchronicity. We don't want things to be all over the place. And that's a really cool tool that I know in the personal injury space, it really kind of depends on which district you're in as far as what's acceptable. In some courtrooms, they will accept QEEG. In California, I don't know per se how it is in Georgia, but anyway, but ultimately, it's you're really assessing the functionality of this person, and through the eyes, there's actually been 3 different biomarkers established over the last year through, Azzolino and Carrick doing these research studies with all these different, devices regarding, ocular motor dysfunction and head trauma, even in a neuropsychiatric world. It really is a way of bringing these clinical symptoms to life. You can actually make a lot of this stuff objective. And for example, there's something called the alpha omega score, which is a new biomarker for head trauma, and it has to do with pupillary constriction fatigue. So back in the day, right, you go to the ER, you got your pen light. No one does the pen light test anymore, right? Or at least they don't out here. I don't know if they do it out there. But that is still very like viable information. You want to like if those pupils, if you have an isochoria, that's kind of the big deal and it's not getting diagnosed. And so it's like first and foremost, come back to a good neurological exam. A lot of this stuff will be elucidated there. You can't just do it all through telemed. Back things up objectively. And guess what? It's all going to make sense clinically. It's all there. It's just that's where medicine has to go. And ultimately that answer is in biotech, and getting hospitals and ER to get into biotech, that's a whole separate conversation.
The good neuro assessment, when you're talking a hospital neuro assessment in an emergency room is much different than the solid neuro assessment you're talking about, which you would need to get in with a very specialized, provider such as yourself to deploy these types of, objective or subjective tests that you might run. So I think that's a great call out. It just doesn't end at the ER. You're just starting that journey. You talked a lot about that structural damage, those white matter, tracks, shearing damage, that sort of thing. The brain, largely in control of hormone balance also. How might those hormonal imbalances that commonly, I should say, follow a mild traumatic brain injury, how do you detect those in the clinical setting? What types of testing do you do to look for, and what are you looking for?
So it's not uncommon that what is known as the HPA axis gets disrupted. So remember, the brain is the supercomputer, and it's signaling down to, glands, organs for them to do their job ultimately, right? Mm-hmm. So first and foremost, with a mild traumatic brain injury, you're going to develop a leaky brain. So a lot of people are familiar with leaky gut, but they may not know leaky brain. And that's just simple, actually, because the protein structure is called zonulin. Zonulin makes up, I'm sure you've had other people talk about it, but zonulin, actin, there's a lot of different aspects to your gut and brain barrier becomes permeable, and it's allowing things to pass through that shouldn't. And so what does that mean? So for the brain, that's a big deal because you're changing the immune system. A lot of what happens with head trauma, again, it's not structural, it's chemical, okay? It's neuroimmune. You have glial cells that get really upset. And when this inflammatory cascade takes place in the brain, there's gonna be effects downward. And so for example, vagal stimulation can be poor. So this predilection for your body to be in this fight or flight mode is naturally going to affect your ability to produce, sex hormones. So a common thing, for example, you should test for in men and in women is testosterone. Testosterone tends to drop. So, and you need your sex hormones, not just for the lovely things that we need them for, we also need them for healing and for cognitive health. So for women, it's been found it's a very big deal. Women, if their hormones aren't balanced and if they're running low progesterone, that's a big deal because we need progesterone to be able to heal. So I've had patients, I've had incidences where we've needed to check their hormones or even thyroid. There's a lot of different things that can happen downstream as a result of this inflammation that's happening at the top. It's not uncommon that within 6 months of head trauma, I will say please, follow up. If you've got a primary, follow up with your primary, get your hormones checked. If not, I will do them, in office. So it's one of those necessary things. The other aspect is also cortisol. So a lot of people, they'll have head trauma. And again, this could also be whiplash. I want to make sure people know that when I'm referring to head trauma, it's closed head trauma. It's not just blunt force trauma. Yeah. It's the brain moving within the cranial vault with whiplash. Yes. And that can create a shearing effect at the very top of the brainstem, which, by the way, happens to me where the nuclei, little communities, if you will, for the eyes and or ear at that location, so you can see stuff there. So I digress. Cortisol. Cortisol is a big deal, and your circadian rhythm can get really messed up after head trauma. A lot of times people will be more awake at night than they are in the morning, or they'll wake up in the morning and feel like they were hungover when in fact they didn't drink anything. So these are all different signs that you can have that impacted, and you need proper cortisol levels to have a healthy temporal lobe for long-term memory formation. So there's, it's like there's this saying, right, within neurology, those that fire together wire together. Well, it's very true in different regions of the brain. The same location for long-term memory formation. I hate to go there, but I got to do it. COVID affects the uncus. It affects a location literally right next to long-term memory, and that's for processing smell, tying it to memory. So a lot of people that end up with cog fog, this is just, your neuroanatomy, you're like, oh, that makes sense. So we're living in a post-COVID world, and so people are more inflamed than usual, and there's all these other things. So looking at hormones, I think it should be commonplace, as well as also looking at the microbiome, because you can have digestion changes that occur, and thinking about other things like other jobs, like the liver, for example. The liver is going to process hormones, and so we just everything's all tied together. So we want to make sure that we're checking everything off, because what does the brain control? Everything.
That is, man, you went deep on that one. You had me thinking, and then you would go on and answer the next question I was going to ask. So you really went deep waters. I like what you said, and we've had other like functional neurologists on the program talking about the endocrine dysfunction, gut dysbiosis. You mentioned circadian rhythm disruptions, and those are all linked to that mild traumatic brain injury or other brain injuries. You started getting into some of the testing, which I think a lot of our audience is unfamiliar with. Those concepts, number one, but there is testing out there that can pinpoint those issues, because you've got to identify those. That circadian rhythm, really impinging that lymphatic system, right, where you're not cleaning out at night, you're not getting rest and sleep are different. Can you talk about the differences between, because the old way of thinking was rest is best, right? You get a concussion, you might just go rest, turn the lights off, just don't move, but not the case anymore. We're finding out it's deep sleep. And then there's activity also that's very important during that time of recovery. Could you speak to that a little bit?
So on that note, there are some sort of kind of rules of thumb as far as rest. Mm-hmm. So there are some people, and I am in this camp, that I do agree that within 10 days of head trauma, you should back off on stimulation. So that doesn't mean none, but you should definitely back off. And so what do I mean by that? So that's be an observer of your body, of everything that your brain is experiencing in the day. So that's like the amount of light, the amount of sound, your vestibular stimulation in a car. Never mind the fact, passenger versus driver. Your computer use. All of these things that we require our brain to do, and even emotional control in situations. We don't think of like cognitive tasks is something that can be challenging for the brain in reading, but it is. So you want to back off on using your eyes. What I tell patients is like check your phone and make sure that you're not going over 4 hours a day on your phone. There really seems to be something to that. So really minimizing scrolling on your phone. You're triggering reflexes and dopamine systems that may not be very happy. So, but after that first, and just do like gentle, like walking, right? Not even walking on a treadmill, because even that can be hard for the vestibular system. But just like get outside and do just a short walk, whatever you're comfortable with. After that first 10 days, then it's go time. Then we need to like test the brain. What are our deficiencies? What's out of balance? What needs a little help? And then after that, feed the brain. The brain needs stimulation. There's some fundamental things that the brain needs. It needs oxygen, right? It needs fuel. You've got to make sure that blood sugar is regulated during this time. And to speak to that, it's not uncommon for people to actually develop blood sugar dysregulation as a result. So it's like you got to keep your protein and your fats high. In the office, you can kind of tell I'm kind of casual clinician in certain ways. I joke that, the brain, we're tuna fish upstairs. Like it's a 5-to-1 ratio for omega-3, omega-6. So it's like we're tuna fish. Get your tuna fish. Yeah. So So up your fish oils, addressing all of that. But ultimately, it's you got to give it the right stimulation. If you've got something going on with your eyes, the oculomotor dysfunction, it can be so debilitating, and people have absolutely no idea unless they've experienced it. I have unfortunately experienced it multiple times. So it's first 10 days rest. After that, you should be involved in a daily type of brain rehab program, but also keeping metabolics in check. So you've got to stay within the range that you can handle. Every time you exceed that threshold, it really is kind of a 3 steps forward, 2 steps back, or even a couple of extra steps. So, it's really important that you stay within that window of tolerance. It's like everything.
Yeah, I think you made a great point about, how did you put it, be an observer of your own body. It's a team effort, recovering from a brain injury. It takes the patient, of course, their family and our friends, support system, what have you, the provider. But I think, to our audience, it is very important, as Dr. Gaston mentioned, to maybe even make notes, keep a diary of your symptoms, your issues, what you're feeling, when you're feeling it, those sorts of things, and bring those to your provider, because it takes all that information to put together to develop that individualized, as you put it, Dr. Gaston, care plan, if you will. You talked about the activity. Well, I appreciate that. Let's get into something you mentioned a little bit ago about the gut and nutrition. That gut dysbiosis, or the leaky gut syndrome you mentioned, exacerbates neurological symptoms after mild TBI. A lot of listeners may not put those two things together. Can you dig down on that a little bit?
So because of that change that occurs where the body switches to this fight or flight mode, that really impacts blood flow, right? Big time. So we're going to have a problem where we're not getting, proper blood flow, quite literally, to rest and digest, which is what that's, parasympathetic, vagal tone, what all of that is. And so with that leaky gut situation, can really set up for, of course, yes, having dysbiosis, being an unwanted host for these critters. The world that we live in, there's X amount of, parts per million of bugs and, gross stuff you probably don't even want to know. But, guess what? This stuff does happen, and people do have parasites. I had a very large case as a med expert where I had to differentiate between what was like an organic basis, what was physiological versus psychological. This individual had cyclic vomiting, all this stuff. They literally were trying to label her as a purging anorexic, and she absolutely was not. She just had a critter. She was an excellent host to a critter, and here in Northern California, there's some people with property that have well water. That stuff happens. Yeah. So I've got to speak to that, a lot of people are walking around with stuff that they may not even know that they have, but they're just being excellent hosts. And so then when they, smack her head or, get into in a collision or, something like that, it's like it was already there, But then at the same time, because all of these barriers open up, what's in the gut should stay in the gut, shouldn't fall out into the bloodstream. It falls out into the bloodstream. You have yourself a recipe for autoimmune responses and even developing food sensitivities. I know this one firsthand. I am unfortunately a proud carrier of EpiPens because I developed a severe gluten allergy that even when one of the times I was hospitalized with stroke, they didn't want to believe it until they saw it, until I was fed something I was allergic to, full on edema, kicked out my IV. Wow. And they're like, oh, Benadryl in your IV, you really are allergic. I'm like, yeah, welcome. So learn from me. Don't be allergic to gluten. Stay away from it for like 3 months. Take care of your gut. There's things that you can do with supplementation, with glutamine. Funny enough, probiotic is not the first place to go. So you got to make sure that you have a healthy environment to then create, you got to prep the soil for then having the good plants, right? Yes. So you got to prep the soil first. So we want to make sure that the gut barriers are intact, that the immune system isn't freaking out. Whatever we need to do, but guess what? There's a nutraceutical approach. There's all sorts of different things. Vagal stimulation. There's brain-based approaches for the gut. You can laser. That's like my favorite part. You can literally laser your brain to improve your vagal tone, increase blood flow. Wow. Yeah.
That is
to
interesting.
then actually downstream affect the permeability of the gut. There's even studies actually show that photobiomodulation over the gut can actually repopulate the gut within 6 weeks, almost like a probiotic. There's
Really?
all sorts of amazing things that are out there. So, but yeah, they really are one and the same. So, like, if you had a chronic GI condition before, like I kind of was alluding to that, especially like, there's a lot of people who have ulcerative colitis, inflammatory bowel disease. That it just means there's already X level of inflammation that's present in the system. So then it's like, then you have this head injury, you're more likely to have a protracted recovery.
I know our listeners were probably just hurriedly taking notes because all of that connection, that deep water of how nutrition, how the gut, and that neuroinflammatory process just kind of interplays with that gut-brain axis. That's always fascinating to me. Not my area of expertise, but that's why I love having expert providers like you on to talk about those sorts of things. Well, that's going to wrap another episode of Mind Matters, Navigating Head Injuries and Concussions. Once again, I'd like to thank today's guest, Dr. Devin Gaston, for joining us today and sharing her knowledge, her expertise, and her passion with us. You can find Dr. Gaston and her team at Passport 2 Health in the El Dorado, California area, as well as their webpage, passport2health.co. I hope that our audience has enjoyed this fun and enlightening discussion and is leaving with a real appreciation for the exciting field of functional neurology and the innovative approaches to treatment available to those struggling with TBI and other complex neurological autoimmune disorders. Please don't forget to hit the like button and subscribe to our channel to keep up with our latest and greatest content, and leave us a comment today and let us know what you thought of today's discussion. And as always, remember, if you're in pain, call Shane at 980-999-9999. Thank you.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.